The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Happy holidays, Merry Christmas, and New Year's to you. Welcome to the Kachmann Mind, Body, Spirit Show. Today, the name of this show is going to be Overdosed America. A lot of people are on a tremendous amount of medication, most of which really is not indicated. They have interactions and they can do more harm than good, but some are necessary, like a type 1 diabetic who just absolutely needs this insulin, so it's necessary. Type 2, that's another story. And we'll be discussing this in detail. So the devil is in the details, okay? And for example, almost most Americans are on statin drugs, okay? I'm not telling you to start them. I'm not telling you to stop them. I want you to gather some information and speak to your doctor about it. They have a lot of side effects. Most people don't know that. You can start gathering some information. You got to read some own books. I'm not sure that you can trust a healthcare provider because over 90% of them really do not know what the effects of these drugs are, the good and the bad part. 90% of it is bad. There are excellent books I'm going to recommend to you, and I've got other YouTube shows you can look at to gather some more information, but good books, you can look at it. One by Dr. Evans, The Toxic Effects of Statins, by Dr. Evans, this thick. Just read the summary, and I think it's page 390. Because the statin drugs, the cholesterol drugs, are interfering with the mevalonic pathway that's just below acetyl-CoA, and so it has tremendous effects. It's not just the cholesterol pathway, it's many other pathways, and they're going to have a tremendous effect on your health. Graveline wrote a book too. I have 6 or 7 books which you can just Google it and say statin books, and there, because I want you to gather some information. Believe me, they can cause heart attacks. They can cause diabetes. Yes. Why would the medical profession give you this drug? Because they themselves, most of them, don't even know that. I've spoken to some family doctors who had taken the drug themselves, and they've had all, one I know has had all kind of back surgery, weak muscles. That's one of the side effects of statin drugs. So let's gather some information and get on this road, okay? What I'm trying to teach you is risk reduction of taking all these medications. Some people are on 10 medications and 70 years old, and their interaction probably has caused the symptoms they got. So we're going to look at the bottom line, okay? Robert Wood Johnson Foundation tells you how to read a medical article. If you want to read some medical articles, you could Google that, and the Robert Wood Foundation, they'll tell you how to read a medical article, because it's difficult. Even average doctor doesn't know how to properly interpret what they're saying, or maybe they never read it in the first place, okay? So a lot of, and the thing you need to know, which is very hard to do, a lot of the people that wrote these articles are being paid by the pharmaceutical company. I know a lot of cancer doctors that get $500,000 every year from the cancer pharmaceutical doctors. I know it. They told me that. So some of the things I'll be saying today you will not believe, but I am at bat trying to inform the people. Studying the wrong people is one of the tricks they use too. They recommend a drug for a certain age group, but their studies were based on a different age group. And so you easily can fall for that. The study may say this drug works in 7-year-olds, but they studied 30-year-olds, or vice versa. They will a lot of times do that because the younger people might tolerate the drugs better and have less side effects to solve a problem they don't have. The older people got the problem. Begin to see what I'm talking about, and I am aware of these things, and so there's no profit to be made from non-drug approaches. That's part of the reason I think this is happening. If you, like myself, I mean it, I'm 87 years old, weigh 135 pounds. I'm on no drugs. All my blood tests are normal. I don't get side effects from drugs. Was I always this way? No, I changed. I read a lot, did TV shows, radio shows, read and wrote books. So I know these things. Knowledge is important. Especially a lot of times when you're written a prescription, there are commercial goals, and the health goals are not properly understood. And there are problems I'm trying to solve. For example, the life expectancy of men in Harlem, New York, is 60 years. You don't hear about it. It's averaged in. You say, oh, men live till age 70-something or early 80s, when there are groups of people who die at a lot younger age, and I'm trying to lengthen their lifespan. So, for example, why do we focus on raising the HDL cholesterol level with statin drugs? Statins have a lot of side effects. Cholesterol, your brain is made largely from cholesterol. Every cell in your body, its coverings are made from cholesterol. They want to hand you a drug that reduce the amount of cholesterol in your body. 80% of the cholesterol in your body is recycled. You only take in the other 20%. And they have serious side effects, as I mentioned in these books you can read. So why are we recommending in a community which already has serious disease, about 34% at the poverty level, to treat them with statins? Will only make them worse. 70 to 80% of the people actually have type 2 diabetes. That's and if you hand them insulin, is very important for the type 1 diabetic, but for the type 2 diabetic, you take the sugar in the blood. That's why you take in the insulin, and you put it in the cell, and the cells swell. Matter of fact, if you take insulin and give it to yourself, you'll see the skin raises up because you're just transferring the sugar from the blood to the cell. Now the cell's got the sugar. Yes. Mm-hmm. So you need to try to get rid of the diabetes, which you can do in about a month. Just look at some of my website by eating the right food, by eating good fats and not much sugar, and your diabetes be gone in a month. It's in my website, so look at it. Read some of the books I recommend. So the original story on drugs, it used to be the research for different medications was paid for by the government. So there was, which is a lot of cost involved in doing the research. It takes a lot of money to do research and bring it to market, a new drug. But the government used to pay for it. But then they realized there was so much money involved, they stopped paying for it. Now the drug companies themselves spend a tremendous amount of money on discovering a new drug, and they want to make the money back. Mm. Now, some of these drugs are necessary, so I'm not against all medications. We've had some drugs are necessary and important. We've had a century of medical breakthroughs, which confuses us. So we think all medications are great, okay? The Salk vaccine in 1955, for example. I was in med school starting at that time, and bypass surgery can be helpful. Dialysis can be helpful, but dialysis can be avoided. Bypass surgery could be avoided if we properly taught it. Tagamet works real good for ulcers. Medications work well for AIDS and HIV, for example. So I'm not saying all drugs are bad, but there's so much money being made in selling drugs, and doctors now have very little time, maybe 10 minutes to see you. So here's your prescription, here's your pill. Instead of talking to you about getting rid of your disease, I'm about prevention. Most diseases are preventable. Diabetes is reversible, but you have to participate and not just say, I'll take your script and start using it. You got to know why you're taking it. Can I avoid taking this medication, for example? You need to ask those questions, okay? And they're expensive, but interesting enough, in Europe, they cost much less because the government is controlling the situation. In U.S., industry is controlling the situation. Matter of fact, a significant number of people in this country cross the border to Canada to buy their insulin drug because it's a lot cheaper there. But I say to them again, you can get rid of type diabetes 4 or 6 weeks. Just look at my website. You can do that. So the prices are cheaper in other countries than here. The companies control the price. Mm-hmm. And you've got an organization that oversees the drug companies, sort of a negotiator in between, but that they're supposed to save you money, but they don't drop the price much, and the drug companies pay them money, and they keep the money. Yeah, these pharmaceutical companies and this in-between organization, they are not helping us and the people that much, maybe a little bit, but not that much. And some drugs have dramatic effect. They can reduce types of lymphoma in children, testicular cancers. So some childhood diseases are helped by cancer drugs. So like I said, they can be important, but you get to know about them. And the Hodgkin's disease, leukemia, they improved with medication. Bone marrow transplants were used with the king, okay, and but it cost $80,000 to $200,000 per procedure, and they made a lot of money. And then they found out there were very little benefit, and they knew about it for a long time before they told you. Okay, so we have a myth of excellent people in the world think we're the best medical care system in the world. Not true. We're ranked 37th, okay? And our health care has been commercialized, okay? And it's getting worse. It is not getting better. We have HMOs and some things that are good, and Medicare, which helps a lot of people, and different systems, managed care, and each has a different value. And one thing that I'd like to bring up, and which I would like you to be aware of, you know what the word, but we're facing a lot of unnecessary medications, a lot of unnecessary procedures, yes. A term that I don't see the med school discussing at all. Hardly anybody knows what the word even means, nocebo. We know that is, I hand you a pill with nothing in it, and if you think it works, 70% chance that it will. Mm-hmm. But they don't allow doctors to do that, to hand a patient a placebo pill. Drug companies stop that. It's allowed in Europe, and it solves a lot of problems, and the cost of these nocebo pills is low. It can help the people without exposing them to risk. Isn't it wonderful? But in this country, can't do it. Not legal, okay? But what's the opposite of placebo is nocebo. I talk to doctors, they don't know, hardly ever met one of them that knew what the word meant. It's in the dictionary. It's real. So I wrote a book about it. It's on Amazon if you happen to want to read it. It's negative speak. It is used in medicine a great deal. It is used particularly with all the new things we have, the CT scan, the MRI scan, the plain x-rays, and the doctor orders those right away just in case he misses the diagnosis that he could get sued. That's done, so it increases your cost, okay, but I can understand the doctor's point of view. But let me give an example. A patient goes to see a doctor like one I saw before. I stopped my neurosurgery practice now. I teach wellness. I saw a lady in a black dress, looked kind of sad. She was having neck pain, and she came in with a 4-page x-ray report. And that x-ray described all sorts of degenerative disc disease, arthritis, and bulges, and all sorts of things. But actually, those were she was 39 years old, and those changes are seen at age 39. It's not a disease. Her doctor, who probably really didn't know, did not realize he was using the x-ray as a nocebo. She was going to get her neck fused by somebody else in a few days. She was seeing me for a second opinion. So instead of looking at her x-ray first, I said to her, "Ma'am, what's going on in your life?" Well, her husband that left 6 months ago, she lost her job a month ago, three children. Can you imagine why she was feeling bad? What most providers don't realize, what most people do not recognize, that we in our body have a nervous system, and the one nerve connects to the next nerve with neurotransmitters, and we have trillion of them. And so if we're stressed out, these neurotransmitters go to work, and they also are connected to our bowel. Our brain and our bowel is connected through the nervous system, automatic, regular nervous system, hormones, peptides. Yes. So the lady was seeing me because of stress. Her doctor was going to operate her. She didn't know better. She just wanted a second opinion about it. So I talked to her a good half hour, established a good personal relationship, and then she did one other thing. She goes like this: "Look at this, doctor." She had a cut over every knuckle. You could see the tendon. What was that all about? That even confused me. But I found out looking at the computer, and I didn't recommend surgery because I thought this was the brain. Emotions were affecting the body. Most people do not realize the mind-body connection. Mind, body, body, mind. Most of the long-term good feel hormone, serotonin, is made in your gut. Yes. So I wrote a book at that time called Mind Body. That's on Amazon. Very detailed. And I wrote it 30 years ago. So I looked at patients totally different. I tried not to do a nocebo on the patients. I treated their emotional thing, and I had things I recommended for them to relax, music and sports and walking and a hug, and sometimes it would take medication. So the U.S. Is indeed the world leader in medical research, but I think we're misinterpreting it and tying a drug to it instead of realizing that this thing is attached to the human body. So we have a prescription thing for everything, okay? But they use a lot less of them in Europe. Also, they cost less in Europe. And the cost of insulin is much higher in this country. But then again, I say, if you're taking the insulin for type 2 diabetes, where you're going to push the blood into the cell, in the type 1, you have no insulin, you have no sugar, and you waste away and you die. So we need it, okay? Well, in the type 2, what I'm saying is the majority of the time, if you eat properly, exercise properly, you don't need the insulin. You can get rid of your diabetes, okay? And cancer rates are higher in people who have elevated blood sugars. So President Nixon declared a war on cancer, but found that in 1971, okay, but found out the cancer rates actually increased. Yes, a few went down, so the physiology, the metabolism was not properly understood. So what I'm trying to teach you how to avoid medications, but you have to gain some knowledge, okay? Here's another one, the saga of hormone replacement therapy. Hormone replacement therapy was recommended, but it was a house of cards. It actually increased the risk, increased heart disease and strokes. It didn't decrease the strokes. So when females stopped menstruating, they started recommending drugs because their hormone level was going down and actually was increasing cancer rates. And but how did so many people get it so wrong? And because the proper tests were not done. The best test to find out if something really works is to do randomized trials, not observational trials, or because you're seeing epidemic of it. Randomized trials means you have some people who don't take the medication, some who take the medication, and that they have similar age groups. For example, cancer is a sugar feeder. Otto Warburg discovered that in the 1930s. So a lot of women with breast cancer actually could be avoided through proper lifestyle. And so they need to do randomized trials where you eat very little, you eat a certain type of food, so you find out what's real. So that the randomized controlled trials are the gold standard. And because the drug companies are paying for more trials of medication, the government is no longer paying for it. So if they see a bad result, they won't even tell you about it. No money in it. No money in it. And so hormone replacement therapy increased the risk and killed a lot of people. Okay, and then eventually that was exposed, and the American College of Physicians of obstetric and gynecology had made the big mistake. They're the ones that are recommending hormone therapy when it was not help cause the disease. So we've had the commercialization of American medicine, and we still do today. Most people I speak to are on a lot of medication when they didn't need it in the first place, if they followed the lifestyle and get rid of it. And the thing that I recommend to people is to learn about it. And I frankly like the keto way. That's what I teach people. It doesn't mean that you get to do it. What it means, learn about what good fats are, bad fats, good fats. And what happens is when you're eating a good fat, 70%, say, and you can eat all you want, because your appetite is going down, your sugar level is going down because you're not eating sugar. The insulin level goes down, the fat cells open up, the fat goes to the liver, is converted to ketone, a high energy molecule, very small molecule. But the heart loves it, the liver loves it, the kidneys love it, the brain loves it. And the easiest way to get to that really is fasting. Your body secretes about 5 hormones in the morning, which keep your blood sugar level, like growth hormone, steroids, some gut hormones, CCK, ghrelin, the one that stimulates appetite, goes down in the morning. And you're not hungry. And so it is with me. I ate my first meal a little while ago, actually. This is what I do. I went to the Divine Connection Cafe by the Coliseum, where I see some people for free to get rid of their diabetes. And I ate guacamole and eggs and had some soup, and I only ate half of it. I do not know why that was the case. I wasn't hungry, so I don't eat. I have another meal, later today. And so it's a perfect storm. HMOs were formed to try to control medical costs. And they had hoped to have more primary care doctors which could teach you about preventing diseases, but there was very little money in it. The primary doctors weren't making money. Medical school was very expensive. Most people don't finish their residency till age 30, and they're deeply in debt. I know. I went through that. So to stop paying the doctors so much for them, they need the money back to pay off their debts. And they formed the self-maintenance organization, but they found, but they were paying the doctors so little they stopped seeing them, and so Medicaid coordinated everything, and the cost came down, but it paid very little. Nobody wanted to see Medicaid patients, but they pay so little. Okay, so patients start using the facilities more, the Medicaid facility, because it was free to the patient. And actually it increased the cost. It didn't save cost, it increased the cost. People went more frequently. So it was opposite to what they thought would happen. Who's at fault? It was a perfect storm, perfect storm. Nobody can predict these things. I'm just telling you about it, okay? And if the Medicaid people are not teaching you how to prevent a disease, the incentive has to be there to prevent the disease. It's not going to help you metabolically that much. So it was a golden age of HMOs, Medical Maintenance Organization, but it had unintended consequences. And so managed care and HMOs in the U.S. were heavily dominated by specialists because the family doctor wasn't making any money, and the specialists charge increased prices, and things were actually more expensive. It wasn't saving them any money. And we need more family doctors. We need more nurse practitioners, ones who are trained in wellness. That's the biggest thing to get you well, to keep you off medications, to help avoid the surgeries. And my opinion, 90% should be family doctors or nurse practitioners or whatever, the ones who teach the patient how to be healthy. Every visit. Now what we're seeing is the doctors get 10 minutes to talk to you. You write you a script and you take us no time to talk to you about prevention. Actually, in England, they now have, it's socialized medicine. It's not any good, but let me tell you something. You can see them on YouTube. There's the Dr. Unwin, UNWINN, and the Dr. David Taylor. They have YouTube shows, easy to find, and they figure it out, just like I do, to teach their patients how to avoid getting diabetes and all their diseases. They noticed the diabetic population was increasing, and now it is decreasing, and they're saving the English Health Service, which is socialized, a tremendous amount of money, and these guys are writing books. So England finally is turning things around. People are healthier, less cost. Isn't that really wonderful? Yeah, you can see Dr. Unwin and Dr. Taylor, YouTube, great shows. Learn their stuff. And that way you have, a second opinion. You might say, Rudy, what are you talking about? Well, that's another opinion. I always ask you to read some books. And so in the U.S., we're heavily dominated by specialists, not family doctor. And they want you to do where they are making money. Not all of them, but the most of them. And if they do surgery, they're going to recommend surgery. If they do angioplasties, guess what? Who's the biggest prescriber of statin drugs among the doctors? Cardiologists. It's criminal. It's criminal. They're the guys that should be leading the fight on preventing cardiac disease and diabetes. Diabetics have a very high rate of cardiac disease, which is totally preventable. And I spoke about to a doctor not too long ago at the country club, and he was stumbling across the floor. And I was reading about the statin books, and I knew he's a cardiologist. What he thought about them, I just wanted his opinion. And he said, statins are God's gift to humanity, just like that. Hell, he himself, I wondered, was probably suffering from side effects of statin. And I've since found out that that was actually correct. I was going to give him these books to read, but I figure if he's been prescribing statin drugs for 40 years and now he's taking them himself, I'm not going to change his mind. It's like a religion, okay? Faith is great. It's healing. I highly recommend it. But you can also have faith in a drug. And med school, they're so far in debt, they have to be orientate a little bit on how much you make, because a lot of doctors have a great heart. They don't care to make a lot of money, just make a decent money, have a decent house and a decent car. But they're so in debt, they need to make more than that. And so the Food and Drug Administration now is under the influence of the drug and medical device system. Half the money the FDA gets from the government, half they get from industry. Guess what's happening there? They're influencing each other. And so the FDA, people think in this book, which I would encourage you to read, it's not just me, Overdosed America, The Broken Promise of American Medicine by John Abramson. I encourage you to read this book. You can also get it at the library, but I tell you, I found a trick. It says it's $13. I wouldn't say very expensive. That you can usually go onto Amazon Books and buy all books used. Susan Ryan's book on Simply Keto, a wonderful book I highly recommend. I highly recommend. $35 new, used $5, and it looks like it's new. So I was speaking regularly to this group of 20 people, and I thought that's the best one because they were majority was seriously overweight, and that's a great book for that. And I bought them for $5. I bought 20. Every person in my group of 20 I was lecturing to got a free book. Now they've lost 15 pounds each. Their diabetes is going away. They're happy, and I'm ecstatic. And the great American drug lobby, the drug industry hires, listen to this, the drug industry hires 625 lobbyists, one for each member of the House and Senate. Each senator and House member gets money from these lobbyists. Mm-hmm. The insurance industry does some of that too, but the drug companies much more. This is right out of this book, okay? So it's not from me. The Republicans get 70% of the money. Mm-hmm. They get 70% of the money. Ask your congressman about it. He'll probably say, oh, I didn't know that. He's getting a check. So healthcare is turning into a commodity. It's a commerce, and it's that way in Fort Wayne. I've been to the hospital systems here and asked them to teach patients how to get rid of their diabetes. I know the ones they operate on the heart. I played pickleball with a guy that was a girl, I forget, that worked with him, no name, no number, and just to let me know what percent of the people were on statins. They said 90% were on statin drugs. The statin drugs help cause the disease they're operating for. Wait a minute, this has got to stop. So I wanted this system, I went to all the hospitals, if they would read some of these books and change what they're doing, but the money ain't there, okay. And although they're running very efficient systems, I never said their systems weren't any good. What I'm saying is, although they have specialists in diabetes and obesity, they're not getting rid of people's diseases. They hand them operations, procedures, and drugs. I know. I've been there. So we have a commercial takeover of medical knowledge, okay? Medical students, let's go to the med school a minute. I offer to give free lectures there. They don't even call. They now moved one of their branches in front of one of the hospital's systems. What do you think? They're going to take their students, interns, residents, and send them to the hospital. The hospital is going to help teach them how to maintain disease. I know. So the first day of medical school training, they're talking about the research. But the research is biased research the majority of the time. Students don't know it. They just accept it, okay? And very hard for doctors who are so busy to keep current to look at a lot of websites. Some doctors do, but it's very few. I know when speaking to them, my house has in it 2,000 books, and because I'm so lucky at the public Allen County Library, and I thank them, that I've read every one of those, and I've read them multiple times because I have these TV shows every 2 weeks. So I get to keep on reading and reading and reading. Does that mean I've learned a little bit? Yes. I didn't say I was smart. All I said is I read a lot. I need you to read a lot. Don't just accept my opinions. So read some. And so at the moment, the medical industry is calling the shots. So they're going to do something big to you unless it's obvious. look at the YouTube shows, look at the books of some of the doctors that I've mentioned. And prior to 1970, you could trust the research at the different agencies. But since that time, the research company, the pharmaceutical companies run their own research and then make their own recommendations. And before 1982, very few drug companies were paying for it. The clinical trials, 80% are funded by drug companies. The power of the purse. Yeah, the power of the purse. So they killed the bird with one stone. The universities are seduced by industry, funding. So we're having a race to the ethical bottom. And studies documented biases in commercially sponsored research. JAMA and British Journal. Odds are that if you pay for the research, odds are 3 to 4 times as likely that you're going to have a favorable review of a new drug instead of an independent agency. Interesting. Okay. Let's look at another one here, which I was practicing neurosurgery at that time, so I needed pain medication for things I saw. Let's broaden the market. Along came the OxyContin drug, developed by the Sackler family in New York City, a very small pharmaceutical company, and they sent them to the pain centers, and their salesman, I remember the sales lady that came to see me to this day, although I remember exactly what she looked like. She was dressed in a manner that no man who had any hormones left wouldn't be paying attention more to that than to have a critical analysis of what she's recommended. I am proud of myself. I never prescribed OxyContin. It was determined that it was quite addictive, and then they increased the dose. And then they promoted laws that if you didn't treat the pain, that was malpractice. Mm-hmm. You could lose your job over that. You could lose your state license over that. And it was, and they put out that we should measure the level of pain on 0 to 10. What's your pain? Oh, it's a 3. Well, you don't get OxyContin. Oh, it's a 9. Of course, the patients have been addicted or wanted just to feel good for the day would order a 9. You take OxyContin. I'm in heaven. Yes. We had a tremendous number of drug addicts in this nation, and we still do. But there were pain doctors that were falsely prescribing it and getting bribes from these companies, and some of them were in town here. Journal Gazette. I remember reading an article. This one pain doctor had billed Medicaid $100 million in 1 year. Of course, they didn't pay all that. But I did review some of his cases. They were sent to me for another opinion. And I found many of those were already drug addicts, and he was giving them his medicine. But the government and Loki did not put him in jail. Mm-hmm. Yeah, then he moved eventually to Muncie, and he practiced there for a while. And eventually they took his license away. But that person should have been in jail, for Pete's sake. A lot of the patients committed suicide, became addicts, and God knows what else. So the industry then will try other reasons to give these drugs. They try to expand it. They push to broaden the market. And remember, I spoke already about the nocebo effect. And so sometimes they even studied the wrong patients, but recommended it for another group of patients and get away with it. They might use older groups when they were given the drug to younger groups, or vice versa. And if there are bad results from the studies, the real data was hidden because it was company-sponsored studies that reveal negative effects, for example. And sometimes they would use ghostwriters and story experts who would write the story in a manner they might have only a very small benefit, or maybe even no benefit, and make it sound so great. And look at your television today, and so they kept on changing the laws. Okay, and today's laws are that you can advertise a drug. You don't have to mention all the side effects, just some of them, and then establish the visualization, which makes it. And you have to mention some of the side effects. Your television that they do. The television situation is so bad that I don't even watch certain channels anymore, because immediately you get these drug advertisements coming on. I'm watch PBS or DVDs or international stations because and they mention the good part on the television first, and then by that time your brain is fried and you don't listen to the bad part of the drug. They mention it on TV. Yeah. Why anybody want to take any of these drugs, I do not know. Because the time you listen to all the side effects, but the way it is done, good effects are the visual things, happy events, and then come out the side effects. By that time you erase switch channels. Very clever, but I'm not falling for it. So these companies are establishing their own spin and using ghostwriters, music, visualization, so the function of medical research in our society has been transformed from a scientific approach to a commercial activity. Yeah, we're duping the doctors. Okay, the doctors are responsible for 80% of the medical expenses. What they do, the nocebo, the placebo, and some are indicated. No question that some procedures and things, some drugs are indicated. So, but these companies will use dinners and lunches and every event, and I've been to some of them, and some of the doctors there have been brainwashed, no doubt about it, because when I will raise my hand or raise the question, afterwards they will say, Rudy, blankety blank blank. But when I think back about it, I was right. I was questioning the use of those drugs, especially the Oxycontin guy. They come give us a dinner. In one day, they would tempt you. One, I remember they had a trip to Australia. They would pay for it. And at the same time, the International Olympics were taking place. Now you're really tempted to go. And then they brainwashed you, and the drug prescriptions went up. Once you've been treated favorably by a company, they found out odds are you will write more prescriptions no matter how you feel to the patients. And in advertisements, 4% of the articles in journals could result in incorrect prescriptions being written. They're not monitoring them enough. And arrhythmia drugs, for example, your heart regulation. They were prescribed in the 1990s because the drug companies know to understand precisely what it takes to persuade a doctor to start prescribing them. They visit the office, they take them to lunch, they take them to dinner. They may meet them in Nevada or Miami or in Australia. And then they convince the organization to make recommendations. And now when I look at the system the way it is now, if a doctor doesn't prescribe a statin drug, they grade the doctor 1 through 4. If you're not prescribing the drug, the hospital system that the employer of now recommends they pay him less. A doctor told me that, a fairly conservative doctor. And so industry, drug companies have us surrounded. We must gather our own information. Pfizer, which manufactured the best-selling cholesterol drug, Lipitor, so they arranged a lot of meetings with the leaders in the field of cardiology. Because the cardiologists don't tell anybody cholesterol is the cause of the heart disease, when in reality it's the insulin level goes up because the sugar level are up because you're diabetic, and insulin punches a hole in the intima and starts the atherosclerotic process. Most heart disease can be prevented through proper nutrition, as I already mentioned. And if that doesn't work, they're working at another one. And sometimes these companies pay the doctors up front. Mm-hmm. So educational courses consist to pull in the therapist and the family doctors. And there was one where they gave a course where they're looking at the x-rays of Kevin McHale's heel where he had a fracture. And they brought you to a lunch and brought the star in to talk to you to get you to prescribe this medication when it really had very little use for the patient. So what the companies look at, are they getting their money's worth from the doctor? So they hired a tremendous number of representatives to see doctors personally. And there's an organization they formed too by drug companies, okay? And for example, Mass General Hospital, great reputation. In Boston, the Purdue Pharma Group, which still exists today. They changed their name, but now they're all over the world. To me, they should be in jail. But they kick back a few $billion to send to addicted people. They're not. So the prosecutors, the judges, the police, I'm a little concerned about that, okay? So Purdue Pharma, the manufacturer of OxyContin, gave $3 million to Mass General Hospital, and they renamed the Mass General Hospital Purdue Pharma Pain Center. Guess what they prescribe for pain in this center? So they donate the money if you're prescribed the drug, so sales are increasing in doctors' offices. It's tripled in 10 years in medication. These drug companies spend $4.7 billion for drug reps and 490,000 office doctors for visit at a cost for them about $10,000. So they give a steady supply of samples in the office. I remember myself as a doctor handing out samples to patients for free, what's a patient more likely to do, even if that didn't do any good? But if they did do some good, and if they didn't, the placebo effect might even make them better. So now the drug companies have affected the guidelines. What should a doctor do? What am I required to do? So 4 out of 5 are written by doctors working with drug companies. The people that are writing the guidelines, which I'm supposed to follow, are written by doctors that make money from drug companies. That's the reality of it. And the smoking gun, too, which I already mentioned, is the cholesterol guidelines. Cholesterol is good for you, but don't stop the drug or start the drug without gathering information and show it to your doctor. It'd be hard to change them because I've given the books to those doctors. They don't change. But if somebody steps up to bat, like they did with cigarette smoking, something that did get done. I do think this drug culture that we have, I think we keep on pushing it. The cholesterol is the most important organic molecule in the brain. Why would you take a drug to lower your cholesterol level? Most people have dementia. They'll say they have Alzheimer's disease. And you give them this drug. Most of the time, dementia is caused by diabetes. But they're constantly coming out with a new drug. Eli Lilly's got another one coming out that might keep you from saying you have dementia for 30 days. So Western Scotland has high rates of heart disease in the world, along with the U.S. And the guidelines about preventing disease, government guidelines now change about every 5 years, but most of them are incorrect. And they'll quote only a few references that led to the guidelines, and the guidelines still say take a statin drug. But remember, I said read these books: Evans' book, Graveline's book, many other books about statin drugs, and why would you want to lower your cholesterol when your brain is made from it. And you need it in every cell of your body. So the new guidelines are not tested well. So and that the new guidelines aren't working should have been news picked up by the national news organizations, but they're not doing it. So. Why aren't doctors more open about it? Well, the drug companies play a large role in how our doctors are educated. It's a conflict of interest have become a normal part of American medicine today. People who don't have the knowledge, expertise, are going to write their prescription. So I've try to get you interested today and looking at John Brems's book. And maybe this will be on YouTube within about 2 weeks, and look at this again. So before you accept a drug, know that you absolutely need it. And this culture, multiple drugs which interact in the liver, has a lot of work to do, can harm you. But don't stop or start a drug because of what I said today. I want you to be a little more open-minded, read more, gather some information, make sure that you really need that script. So, some need it, no question about it. But thanks for listening to this. And I do this because I care about you. I ain't trying to prevent, stop, reverse illnesses. The medical industry, pharmaceutical industry, the government has us surrounded.